73-year-old Kalina Donda was diagnosed with uncontrolled high blood pressure a few years ago. The sole breadwinner who cares for a physically disabled child and a grandchild relies only on a government grant. She often cannot afford the transport money to get to the nearest government clinic. As a participant in the clinical trial, she monitors her blood pressure regularly with a blood pressure monitor kept at home. She complains of painful swelling in her knees, but says her health has improved.
I
have a mat knitting machine which requires me to use my hands a lot. This is a great form of exercise whenever I feel my hands are getting numb. I also try to collect small amounts of wood and I clean my yard just to keep active. I do suffer from backache and my knees swell, but since I have been part of this program, I am much better. My blood pressure is now normal as I monitor it every day.
Key to the trial are trained community healthcare workers. Fikile Managuza supports and visits her 32 patients at home twice a month for blood pressure data collection and medication delivery. Some data is transmitted to a mobile application received remotely by a nurse for real-time diagnosis, which leads to quicker intervention. Managuza also advises her patients on lifestyle changes, such as healthy diets and regular exercise.
It has always been my dream to make a difference in people's lives. This job has helped me to fulfill that dream. When I hear testimonies from my patients that they are no longer sick and that they are able to keep their blood pressure low, it brings so much joy. Working with people is not easy. It's a calling and you need to be passionate.
Controlling hypertension is a global problem, a condition which can be prevented and treated. Most people are unaware that they have the condition, which is often diagnosed only after complications such as heart or kidney disease. A clinical trial called the Impact BP trial focuses on implementation science, which means intervention in a rural setting where people have few resources and lack access to healthcare facilities.
We showed that in the standard of care arm, where things are under the usual way of treating blood pressure, the control was at about 57% at 12 months, and in the other two arms where there is this intervention, and we're implementing this trial to see if there's going to be a difference by bringing community health workers in and bringing medication to the patients. The improvement at 12 months was up to 80% of control in the people that were being visited by community health workers and having their medication brought to them in their homes.
There were 774 participants in the trial, the majority of whom were women. The average age was 62, while 14% had diabetes and 47% were living with HIV. 68-year-old Nokwinziwa Nsele tends to her vegetable garden, which she waters by harvesting rainwater. She says this has helped her eat nutritious food and made her more aware of focusing on her health.
This program has really played a major role in our lives as the elderly people. We didn't have to worry about waiting in long queues at the clinic. This is because the RE healthcare workers conducted home visits and they would help us with our medication.
Researchers say the trial has proven that equitable healthcare can be achieved in under-resourced communities.
All of these means that we then have less congested clinics. We have less overworked nurses that can then focus on the patients that actually have to be in the clinic. The nurses are then able to identify those patients that need to have their care escalated in good time. In the long run, if we don't do what the evidence is showing us, is that our life expectancy will continue to go down. we will have, and this has an impact on our economy.
Magula says similar models of care can be used to improve hypertension control in other remote settings in the country and for people with multiple comorbidities. Renee Heine, SABC News, Somkhele.